have a global health preparedness program that was launched last year, but we started working on it several years ago. And we have a peer-to-peer partnership with several other institutes of public health. And to date, we have developed 4 of those with the Palestinian Ministry of Health, with Ghana, with Moldova, and with Malawi. And we're planning to go into 2 more partnerships within the next 5 years. This is a 5-year program, but we will continue to develop those partnerships for many more years after that. We consider this to be very long-term partnerships. Yes, I mean, we've had international collaborations and projects for many, many years, but we saw a need for building institutions and infrastructures across the board of all the public health core functions and needs, and to contribute to building health systems in countries where the health systems are fragile or weak. So that was the basis for going into these partnerships. And our first partnership was with the Palestinian Institute of Public Health, and that was certainly a case where there was a need, or is a need, for further development of institutions. Yes, IANPHI has been very important in the sense that IANPHI is part of this collaboration and has provided the list of core functions. But in addition to IANPHI, the WHO is important, and the implementation of the international health regulation, because part of this is assessment of the international health regulation implementation in those countries, and it's also a way of implementing it. Well, our experiences with IANPHI are very good, and our institute has been part of IANPHI since the very beginning, and to see how IANPHI has developed is really amazing. We didn't think it would succeed this rapidly in gathering so many different countries into one organization, and I think the potential is great because there are many policies under development, but also there is a need for people on the ground in many countries that are experts in the field to contribute to the development of policies both at national and international levels, but also to implement them and to be critical of how they work and to adjust them when that's needed. So I think IANPHI is at the very beginning of a very long-term and very potentially very successful collaboration. Well, it's not that uncommon in the Nordic countries or the Northern European countries, but still it's relatively uncommon even there. And in fact, I think I'm the first one, even in the Nordic countries. But to the extent that I can contribute to support of upcoming female leaders or women leaders in public health, that would be very good, and I would be glad to do so.